Nice to meet you too.
I'm Kim,
Kim.
from Ajou University. So I'm director in the House Spaces Business Innovation Center.
Oh, okay, great. So this whole setup is the HBIC, right?
Right.
Okay, fantastic. And so you brought together universities from many different
Right.
parts of Korea, and
Right.
this particular one is
Yeah.
Ajou University.
Right.
So what do we have here? What is this?
But actually, I don't know this interview is based on the English, but so can I?
Of course, in
So
Korean.
Korean.
Absolutely.
Okay? Yeah. 그래서 우리는 이제 아주 대학 병원에서 그 23개 이제 스타트업을 저희가 인큐베이션하는 이제 사업을 하고 있고요.
So there's 23 startups
Yeah,
here
23.
underneath
So there
the
is a-
guidance of Ajou University.
Yeah, right. So there is two categories. So one category is based on there is a based on the in laboratory lab. So they work several in the research researchers that they do their experiment and in laboratory. There is only 13 hospital, 13 is company, but other companies they don't need to in the in 입주. So we
They
say
don't need to
that.
be there, right?
Yeah. So there is a non-입주. So there is a 10 companies is.
So 10 companies are more under your guidance, but not necessarily using the laboratories at the hospital.
Yeah.
I see.
So in there is a 5 hospitals in the HBIC in our country.
Oh, okay.
So one of the is the Ajou University is based on the in the focus in the bio and the drug or new drug and the new technologies based on the experiment. Other hospitals based on the digital therapy and medical device, but we focus on the medication development company.
Is this where a lot of patients you do a lot of tests on patients with new drugs? You bring in patients. Is this where that happens? Or
Yeah, it's a rate stages, so we can do
Late stages, yeah.
it's a clinical trials in our hospitals and in our institute. But until now, there is most of the companies are startup, so it's a very early stages in the in vitro and the in vivo experiment.
right.
Yeah.
So it's just so the hospital itself supports these companies. The hospital
Right.
system has 23 different ones.
Right.
13 that are needing the laboratories
Right.
or needing the equipment there.
Exactly.
Oh,
So we there is a 3 representative in the company. So I'd like to introduce.
Sure.
That this is Aden Hygiene. So there is only 1 year ago they start this company, but
Wow.
this is a focus on the. As you know, this is the COVID-19 era. So they focus on in the infection, the sterilization.
Yeah, sterilization.
Yeah, so using the UV. So there is a collaborated in the LG electric companies or other big company, but there is several patent, and there is a focus on the new device is based on the UV system and the sterilization.
Wow, great.
Immunabs is based on the global, therapeutic antibody, focus on the cancer or inflammatory disease. So they developed 3 pipeline based on the therapeutic antibody. So it's a very promising in the startup, I think.
Immune labs.
Yeah, Immunabs.
Great.
And
And over here.
the last one is the 독립bio. So they are, it's already 7 years ago they start and relatively old startup, but they're focused on the many categories in the drugs and some.
Well, we got to see this yesterday. This
Yeah.
is for recording maybe temperature, was it?
Right.
And you can put it on underneath your armpit
Right.
for babies or for
Right.
older adults, correct?
These days they're focused on in the digital device is wearable.
Wearable
so
device, right?
measure the temperature and even those blood pressure and heartbeat.
Right.
Yes, it's very in the useful for in the risk patient.
Right.
So there's an alarm to in the
To send an alarm to like a phone or a device or a hospital wherever it may be needed, right?
Right.
Fantastic. So these
Yeah.
are the three companies represented today under Ajou University.
right.
Really, thank you so much for sharing this information
Thank
with
you.
us.
Thank you.
It was great.
Yeah.